Pericardium. So, in this catheter ablation for most arrhythmia substrates is performed frequently from within the cardiac chambers using an exclusively endocardial approach. Although epicardial ablations have been performed for many years, they have been from within cardiac veins, mainly the coronary sinus. Epicardial mapping and ablation. Because of the clinical need to manage ventricular tachycardia in patients with Chagas disease, the earliest experience of epicardial mapping and ablation using subgeoidal approach came from Brazil. New tools have become available for epicardial approach without the need to open left atrium. The pericardial approach is an emerging clinical necessity and is increasingly important when dealing with complex arrhythmia. Pericardium. The heart and the adjoining great vessels are enclosed in a sac. The parietal fibrous pericardium. Superiorly, the fibrous pericardium is continuous with adventitia of great vessels, the ascending aorta, pulmonary trunk, and superior vena cava. Several centimeters above the site of SA node. Relations. Pericardium relations. Anteriorly, as you can see in the picture, it is attached to the posterior surface of sternum by superior and inferior sternopericardial ligaments. Laterally, there are the pleura of the mediastinal surfaces of lungs. The esophagus, descending thoracic aorta, posterior part of mediastinal surface of lungs are related posteriorly. Inferiorly, the fibrous pericardium is attached to the central tendon of the diaphragm. The diaphragm separates pericardium from liver and fundus of the stomach. Bare area. There is a small area behind the lower left half of the body of sternum and sternal ends of the left, fourth and fifth costal cartilages, where the fibrous pericardium is in direct contact with the thoracic wall. This area does allow pericardial space to be accessed, but care to be taken not to enter the right ventricle, which lies behind the space. Instead, most operators use subxiphoid approach for the puncture. Serous pericardium. The pericardium is a delicate double-layered membrane called serous pericardium. One layer of the serous pericardium is fused to the inner surface of fibrous pericardium. The other layer lines the outer surface of the heart as epicardium. Over the great vessels, the junction between two layers are the pericardial reflections. Separation of two layers of the serous pericardium creates a narrow space, that is pericardial cavity. Under normal conditions, the pericardial cavity contains approximately 20 ml of fluid, which is plasma ultrafiltrate. This pericardial fluid serves to lubricate the moving surface of the beating heart. Pericardial sinuses. The pericardial cavity has two sinuses. These are extensions of the cavity. Transverse sinus is delineated anteriorly by the posterior surface of ascending aorta and pulmo-trunk bifurcation, and posteriorly by the anterior surface of atria. Oblique sinus. Oblique sinus is a large cul-de-sac behind the left atrium. It is formed by the continuity between the reflections along the pulmonary veins and the vena cava veins. Phrenic nerves. Extracardiac relations, phrenic nerves. The importance of the phrenic nerves is often under-recognized. Accompanied by pericardiphrenic vessels, the phrenic nerves descend bilaterally onto the fibrous pericardium. Right phrenic nerve descends almost vertically, first along the right brachiocephalic vein, then along the right anterolateral surface of superior vena cava, and continues its descent immediately in front of the right pulmonary veins. Left phrenic vein descends behind the left brachiocephalic vein, continues over the arch of aorta, pulmo-trunk, onto the pericardium, descends anteriorly or anterolaterally over the area of left ventricle behind the cardiac apex. Esophagus. The esophagus descends through the mediastinum related to fibrous pericardium behind the posterior and inferior walls of left atrium and the junctional areas of the atrium with the pulmonary veins. Esophagus, because of its flexible position behind the heart, it serves an excellent portal for transesophageal echocardiography. Another relation is diaphragm. Pericardium rests on almost flat area of the diaphragm called cardiac plateau. Most of the inferior surface of diaphragm is covered by peritoneum. Right side is molded over the convex surface of right lobe of liver, right kidney and right suprarenal gland. Left side conforms to the left lobe of liver, the fundus of the stomach, spleen, left kidney and left suprarenal gland. Blood supply and lymphatic drainage. The fibrous pericardium is supplied by pericardiophrenic and internal thoracic arteries. Lymphatics from the ventral surface of the parietal pericardium passes along the phrenic nerves cranially. On the lateral surface and posterior surfaces, the lymphatics anastomose with lymphatics of the reflected mediastinal pleura. Nerve supply. The fibrous pericardium and the parietal part of the serous pericardium are supplied by the phrenic nerve. The visceral pericardium is insensitive and its nerve supply is similar to that of heart. Pain from the pericardium originates in the parietal layer only and is transmitted by the phrenic nerve. Thank you.